Theo, Lakshmanan, they, them pronouns. I am the residential therapist here at 360 for our transitional housing and rapid rehousing programs. So I provide therapy, mental health, general wellness drop-ins, and more formal therapy and mental health services to the folks that live here in our programs, age 18 to 24. I see lots of different clients in different ways. So there are about 40 to 50 folks who engage in the services, the transitional housing services in total. And out of those, maybe about a quarter or so, I see at some point for some kind of mental health or wellness drop-in services. In addition, though, I see lots of other folks who live here in maybe even more informal ways, such as different community or other groups, and even more broad chances to share space and promote wellness. One really key piece of this role and how this position works is that we can offer therapy services through a grant, so at no cost to the folks who come in for different therapy or other wellness drop-in services. There are a lot of barriers that young folks, especially young folks who are in transitional housing programs, face to accessing mental health services, and a lot of those big ones are related to finances and insurance. So being able to connect folks to services right away that they're looking for without having to go through insurance or other financial barriers is really, really important, huge piece of the work. Support through the grant has been around providing equitable access to mental health services. So there are a lot of barriers that folks face due to socioeconomic status and insurance, other factors, especially the folks that are here, a lot of the folks that are here in this program. And so the VNA is crucial and essential in being able to fund this position, my residential therapy role, to be able to offer therapy sessions at no cost to the folks staying here, which is huge. And in addition, because of the grant and different ways that we may look at like mental health more broadly, the grant also supports in providing access to psychiatry services. So not through myself, but through a partnership with another organization that very similarly, when folks have barriers to access to psychiatry care, wait lists can be really, really long. So we can provide services within a month or a couple months of folks expressing interest, which is huge. That's a really rewarding piece of the work is to be able to go from folks being at really difficult points in their lives a lot of times, and to be able to make space like right away whenever folks are coming in and wanting to talk, and just right away being able to learn more about them and offer different kinds of support. I've met with so many different folks that whether I've seen them once or twice or dozens and dozens of times for sessions, that all along the way I see that people working towards things that are really important to them and being able to share space about things that are really important to folks that maybe they don't have supports otherwise or a safe person to talk to.